Dear students, welcome back. Now we are going to discuss about the sternoclavicular disc. This is the sternoclavicular disc here. Which is diagonally placed inside the joint. And this sternoclavicular joint actually is covered with the capsule. It is covering the articulating surfaces of the joint. One is the manubrial facet and also the medial end of the medial margins of the medial end of the clavicle and also the first costal cartilages forming the capsule. Inside the capsule, in between the two articulating surfaces, this sternoclavicular joint has a fibrocartilaginous disc. This fibrocartilaginous disc increases the congruence between the articulating surfaces. The upper portion of the sternoclavicular disc, so this is the upper portion of the sternoclavicular disc, is attached to the posterior superior clavicle. It is attached to the posterior superior clavicle, while the lower portion is attached to the manubrium. So here it is attached to the manubrium and also the first costal cartilage. Lower end is attached with the manubrium and first costal cartilage. And also this disc is attached anteriorly and posteriorly with the sternoclavicular joint capsule. So these are the attachments of the sternoclavicular disc. The sternoclavicular joint has a fibrocartilaginous disc which increases the congruence between the articulating surfaces, and the upper portion of the sternoclavicular disc is attached to the posterior superior clavicle, while the lower portion is attached to the manubrium and the first costal cartilage. And also on the anterior side of the disc and the posterior side of the disc, it is attached to the joint capsule of the sternoclavicular joint. These are the attachments of the sternoclavicular disc. So the disc transects the sternoclavicular joint diagonally, joint space diagonally. Here you can see, so it is dividing this sternoclavicular joint by placing this disc in a diagonal fashion. So it divides the joint cavity into two separate cavities. One is the medial side and another one is the lateral side cavity. So the lateral joint is formed between the medial end of the clavicle and the lateral surface of the articular disc, whereas another joint, that is the medial side of the sternoclavicular joint, is formed by the notch of the clavicular notch of the manubrium sterni as well as the medial side of the articular disc. Okay, it divides into two joint cavities. So during shoulder motion, the disc acts like a hinge or pivot. The disc acts like a hinge or pivot point for the medial end of the clavicle. Okay, so that thing we are going to see now. So how it acts as hinge as well as the pivot point. So during elevation and depression of the clavicle, so if they mentioned elevation and depression of the clavicle, means elevation of the clavicle, so this is the normal position of the clavicle. Once elevation means it will move up like this, the clavicle move like this, and depression means again the clavicle comes like this. So that is the elevation and depression of the clavicle. So what happens if it is in the elevated position? If you can see, this one is the elevated position like this. So during elevation and depression of the clavicle, the medial articular surface of the clavicle, medial articular surface of the clavicle will roll and slide, on the relatively stationary disc. So the disc will not move, relatively stationary disc with the upper attachment of the disc serving as a pivot point. This one acts as a pivot point. That means, so it forms as a fulcrum here, and this will move, the medial articulating surface will roll and slide on the articular disc which is stationary in position, and the superior attachment or upper attachment of the disc acts as a pivot point when during elevation and depression of the clavicle. Okay, so that means this one is stationary and this one is also stationary, and these two forms one component during elevation and depression. Okay, when coming to the protraction and retraction, during protraction and retraction of the clavicle, protraction and the retraction, that means, so the clavicle is present like this, so the clavicle will move like this. This is protraction and this one is retraction, so it comes forward and backward. So protraction and retraction of the clavicle, the sternoclavicular disc and medial articular surface. So medial articular surface, so these two forms a single point. So these two unite to form a single component here. So during protraction and retraction of the clavicle, the sternoclavicular disc and the medial articular surface roll and slide together. These two roll and slide together on the manubrial facet with the lower attachment as a pivot point. Lower attachment of the disc acts as a pivot point. So what happens during elevation and depression? During elevation and depression, so the disc is in stationary position and the medial articular surface will roll and slide during elevation and depression. Whereas in the case of protraction and retraction, these two, the medial articular surface as well as the disc, both structures will roll and slide on the manubrial facet, and the lower attachment of the disc serves as a pivot point in the protraction and retraction. Okay, so the disc therefore is considered as a part of manubrium. So the disc is considered as part of manubrium during elevation and depression, and this disc and the medial articular surface acts as a single component during protraction and retraction. Okay, the sternoclavicular joint provides stability. So the disc provides stability here. The sternoclavicular disc provides stability by increasing the joint congruence, joint congruence. Normally the joint is present in this only, this part, isn't it? So only the clavicular notch like this. So because of the disc present, so disc is attached to the costal cartilage. So from superior portion and this up to this part, there is a rotation of the clavicle is taking place. So the sternoclavicular disc provides stability by increasing joint congruence and by absorbing forces, and also absorbing forces transmitted along the clavicle from its lateral end to the sternoclavicular joint. And because of this unique diagonal attachment of the sternoclavicular disc helps to limit the medial movement of the clavicle, okay. And the disc also has a substantial area of contact with the medial clavicle, which helps dissipate medially directed forces, protecting the small manubrial facet from high concentrations of pressures. So, and these medially directed forces on the clavicle are infrequent and very rare. Okay, so this is about the sternoclavicular disc. So the main function of the sternoclavicular disc is to increase the congruence between the articulating surfaces, and also the attachments of the disc acts as a pivot point during sternoclavicular motions. Okay, in the next session we are going to see the capsule and ligaments of the sternoclavicular joint. Thank you.